Hi, I'm Daniel Balaze, and I am here to talk with you and answer all of your questions today about dental implants. So first, we're going to answer the question, what are they? What are dental implants? They are essentially small little bolts that go in your jaw. They're usually made out of titanium, but sometimes in today's world, they're being made out of a material called zirconia, which is a wonderful metal-free, slightly more aesthetic option. They all have threads on the outside and resemble a tooth root. And most of them have threads on the inside as well. And that allows us to attach different things like crowns or denture attachments to them. Like I said, the majority of dental implants are made out of titanium. Increasingly, there's more companies that are making them using material called zirconia, and that is more aesthetic. It is a ceramic, so it's metal-free, but the limitations are that a lot of those companies are making them as a single piece, which has advantages and disadvantages, but they're certainly less flexible in terms of how we use them in dentistry. So let's get into that question. What are dental implants used for? In today's world, they're used for one of three main things: to replace a single tooth or multiple teeth. The second reason is to help hold on to a removable denture. And the third reason is to help move teeth in orthodontics. How do they work? Dental implants work through a process called osseointegration. When your bone heals around that implant, it is able to, because of the material of the implant, the titanium and the zirconia, able to heal right up to that implant. So when we look at a microscopic level, it goes from titanium or zirconia right into the bone. There's nothing in between that. That locks the implant in place and makes it very stable and great to put a tooth on. How long does it take to get a dental implant? Most dental implants take about 4 months to heal and about a month or so to get a crown on top of that. Sometimes we can get a crown made for that implant in the same day if it's made in the dental office. Sometimes we can get it the same day that the implant is placed, but usually it takes several months. Sometimes we need, and it's for the patient's best interest, that we need to place the implant in 2 stages. We need to do the surgery to prepare the bone, whether that's removing an old tooth or maybe even augmenting a bone, making it wide enough to hold on to an implant. Maybe the tooth was missing for a very long time and we need to do a surgery to give us enough bone, a sinus surgery, something like that. In those cases, that bone needs to heal for several months before we can actually place the implant. Once that implant is placed, then again, we're waiting another few months before we can put a tooth on that. That's the usual progression. Sometimes there's always variation, but usually between 4 to 8 months is how long it's going to take to get a tooth on your dental implant. The last question I want to answer today is if people are going to notice or know that you've had a dental implant placed. And the quick answer is no. Nobody's going to know at all, even from a conversation distance, and even if that person is a dental professional, a dentist, a hygienist, or a dental assistant, nobody's going to know that you have had an implant placed there. I've also made a short video about the cost of dental implants and why there's such variation from area to area, from doctor to doctor. So please check that video out. I hope this has been useful. Leave any additional questions you have about dental implants in the comments below, and I'll be sure